years ago when the R word was never said in these rallies. But now we say the R word, and that is recovery!
But we've made significant progress over the last several years, both in the area of treatment for addiction and taking it even further than that, offering alternative opportunities of intervention for those who are in the criminal justice system that's primarily drug and property related, basically addiction-driven crime. An awful lot of people in Georgia through the years have went to prison for their addictions, when treatment, as we know, could have easily gotten them back on track and back to being a productive member of society, and we've made some incredible strides.
What personally worked for me, some of my pathways was, treatment. It was having somebody there with the lived experience. It was the continuity of care that after I left out of the treatment doors and didn't really know what to do, that there was things in the community that could assist me to sustain it.
If there's more local places around town that people that need help can actually seek it and not have to worry about somebody pointing a finger or somebody being judgmental towards them, then it'd make it a lot easier.
Services are available, they need to know that, so they can get the same hope and another life.
With the governor's support, the governor's leadership of providing accountability courts, mental health courts, addiction courts, veterans courts, we've opened up what we call integrated treatment facilities in Georgia to treat those individuals who have both a mental illness and an addiction.
It is very important to us that we provide evidence-based services to those offenders that need the services and provide them effective treatment so that we can try to break the cycle of addiction.
Prevention is effective, treatment works, recovery is real.
In my experience, I work at Chatham County Jail, and what started happening while I was working there is I started seeing some of the same faces, and I said, why am I seeing the same faces? And the biggest thing was that these people did not have support. They did not have resources. They did not know where to go in their addiction. And they were full of shame. And many of them had felonies and they couldn't get jobs. And I said, what can I do? I want to make a difference. So I went back to school and got my master's degree in social work at 50. And I want to try to make a difference in people's lives, bring resources to them.
An estimated 21.6 million people are classified in our nation as having substance abuse or dependency. This is a large and drastic impact on our communities, our family, and most importantly, the children in the communities.
We created and advocated for the Georgia 911 medical amnesty and naloxone access law. Our mission now is to educate, implement, and develop resources for this law, and ultimately our goal is to save lives. In the 9 months since our law was enacted, we have 127 lives.
I went to 20-something rehab 20 times in 2 years or less. I don't have to do that. You don't have to do what I did it for you. It's the same message coming from different people. The same judge that I signed over, I had signed over temporary rights of my children, I had the opportunity to work for that same judge on the other side of the table.
I talk about my recovery as often as possible. As y'all can't tell, I'm super excited about it. Super excited. It's the best thing that's ever happened to me.
I've had some experience with being involved in the correctional system, and there were some things that they did get right, but I think that there are some things that we could work on and need to be tweaked. And one of the biggest forces for me in my life was the kindness and compassion that others had toward me.
In recovery is when everything is going my way and things are clicking along and things are going the way that I want them to go, right? That's a good day. A great day in recovery is when nothing goes my way. And I practice principles of the program and I show up and I do it anyway. That's a great day.
Keep doing what you're doing. Keep telling your stories. Keep advocating for what you believe in. That's the only way we're going to make a difference.
The treatment is working, the peer support programs are working. I am super excited that Georgia is the leading state with peer support. Georgia rocks.
I battled an addiction for over 20 years, and recovery has given me a life beyond my dreams,
So my recovery has given me so much. So much. And I like to see that happen for other people. And if we're not here as people in long-term recovery promoting it for the people that are new to recovery, who's going to show them the way?